Today, the community-based group called the Safe and Healthy Spokane Task Force released an independent report on the region's behavioral health and homelessness crisis. KREM 2's Regan Gallo reports on what the results reveal and about the impacted communities. Regan?
Well, the Safe and Healthy Task Force's independent report highlights gaps and offers a framework for public health and safety improvements for local authorities to consider. Based on the findings, I spoke with people experiencing homelessness to hear their perspectives firsthand.
On a cold day when slush and ice cover Spokane, the Resource Navigation Center on Cannon Street stays busy of people seeking help.
I'm gonna build a kingdom.
Daniel Mendoza, a local since 1993, has been homeless for 7 years. He says he hopes to find stable housing and to pay it forward.
A kingdom of love and peace, tranquility. We all need to pitch in to help the homeless.
Another man shares a similar sentiment.
We really rely on each other, we really do.
When I spoke to him, he was brought to tears. Before Spokane's latest homelessness services launched last fall, he says those living on the streets relied heavily on each other to stay safe.
When we didn't have any services at all, we all banded together no matter what.
Because of lived experiences like Gary and Daniel's, the Safe and Healthy Spokane Task Force says with research and conversations, they found the gaps the region faces when tackling public health and homelessness challenges.
The assessment looks at crisis response, housing, reentry, behavioral health law enforcement, facilities, the continuum of care, and the courts. It shows how each part can connect and how much more effective we could be if we organized our systems around care instead of punishment.
The report notes that Spokane has a strong foundation, but resources and crisis teams are still challenged with housing and workforce shortages, data gaps, and a lack of a streamlined approach. Efforts made across the region gives individuals like Mendoza hope for change, a goal the Safe and Healthy Spokane Task Force says they are working to achieve.
What can we do to make it new and help other people? It's like, if you see somebody hungry, feed them. If you see somebody in danger, help them.
Now, task force leaders say they will use the findings to develop next steps for local city and county officials, aiming to improve systems and outreach services this spring. For now, I'm reporting in the studio, Regan Gallo, KREM 2 News.